Health, a show we are starting between four friends, four guys who are building Presidio Healthcare. Know Thy Health is a way to share health insurance wisdom with you all for navigating healthcare. Our team is actively building the nation's first pro-life Christian health insurance company, and we are actively having conversations every day with consumers, with health insurance partners, brokers around the topics of navigating health insurance. And it dawned on us, it's like, hey, we have a lot of history and a lot of information here that we can share with folks. So we're excited to not only share our experiences and our opinions, but also bring guests on in the future to talk about things that are very relatable to you as a consumer of health insurance and a consumer of healthcare. So just to move on and introduce the three guys here. We have Daniel Cruz, our CEO. I like to call him the risk whisperer. He's an actuary by training. He's well publicized, has written a lot of opinion pieces on health insurance, and excited for you guys to get to know him. Bob Hogan, our healthcare lawyer. We don't have a great nickname for Bob, but that makes sense because he's a lawyer. And,
creativity is not our strong suit as lawyers.
Yeah, we have to use the most, factual and truthful terminology when we describe Bob so that there's just no room for disagreement. So he is our healthcare lawyer and has a lot of experience working with providers, hospital systems, all through the entire gamut of the healthcare industry. And him and Daniel came together to build Presidio and brought Alex and I along with them. Alex Hart, a long career at Medishare, a Christian care ministry in the healthcare sharing ministry space, and has worked in healthcare for a long time, even before that. Brought together $1 billion worth of savings over 15,000 cases in 5 years at Medishare. He's an expert in cost containment and is really well-versed in strategies for saving money on healthcare expenditures and services. So we're excited to bring our minds together and tell you just a little bit about what we know and what we've learned along the way. So I'm going to hand it over to Daniel. He's going to give you a brief overview of Presidio, why we are building Presidio, who we are. So I'll let you take it away, man.
Yeah, and you forgot the most important nickname, the Bill Butcher for Alex. Which we
Alex is the Bill Butcher.
Yeah. So, no, as I think about this group, and why we're building the nation's first Christian health insurance company, really the first thing that comes to mind of why build this in the first place is that, our first obligation is ultimately to God, our creator. And when you think about healthcare belongs to Christ. It belongs to his ministry, his healing ministry. I've reflected on, the miracles of Jesus Christ. Almost 2/3 of his miracles are of a healing or a restorative miracle for the people that he was interacting with. And, I think it's so beautiful to kind of think of that image like God wants to save us. That's a healing, a restorative process to make our souls rightly ordered with God. And so he uses this very physical aspect of healing our bodies to point to ultimately what he wants to do for our souls. So that's really why healthcare belongs to our Lord. And unfortunately, if you think about our healthcare industry today, we've ceded ground to now you have organizations. When we think about health insurance, you think of like Blue Cross Blue Shield, where literally they're taking the cross of Jesus Christ and they fund services that violate the dignity of the human person: contraception, abortion, abortifacients, sterilizations, these things that violate really the icon of the Holy Trinity, the mother, father, child relationship, but also just who we are as made in the image and likeness of God. So the very first thing of why we're building this is ultimately to reclaim healthcare for Christ, to reclaim his ministry that is rightfully his. And I find that, in today's world, in today's, the United States, our history, it feels like this moment in time of reclaiming. I think often of like The Chosen as, the entertainment industry or storytelling, which, kind of has become secular. Storytelling belongs to God. And you have Chosen coming out there and producing something beautiful and saying, no, storytelling belongs to Christ, and we're going to do it at an excellent level. So I think that's the first thing, is we owe it to God to create a world-class, excellent health insurance company to promote Christ-centered healthcare, because it ultimately belongs to Him. And then I think the second piece then comes down from God into like the actual Christian community and Christian families, where just to go into our name a little bit, we named ourselves Presidio, which is after the 4 Presidios here in California. California was established with the mission system, St. Junipero Serra, wanting to evangelize to the Native Americans here. And it's that idea of we as human beings are both body and soul composites. That's what a human person is, made in the image and likeness of God. And so what I've always loved about the missions is you take care of the body first. They took care of the material needs of the natives here in California, with the ultimate purpose of evangelizing them. So we took that image of Presidio, which means fortress in Spanish. They were the 4 Presidios meant to protect the missions in California. And the idea is that, like, primarily we need to serve people with a great health insurance and healthcare option that takes care of their physical needs. You have to have an insurance product that's going to be there when your family member gets cancer, when your family member has a heart attack, has an accident, some of these most dire moments in your life. You have to have the assurance that your insurance company is going to pay those medical bills so that your family member is going to be okay. But at the same time, if you take care of the material good, there's a mission behind it that to flip healthcare on its head, a healthcare system that has gone astray and away from the Lord, we can actually make people aware of Christ-centered services, equip them to go after Christ-centered services like natural family planning or NAPRO technology, these holistic healthcare options. And then how do we make it, a cost savings for them so that they can save thousands of dollars on their premiums, but also make access to these life-affirming pieces, easier to access on a cost basis. So that's kind of the two things: to honor God, to serve people. And then the final reason, I think I get this question a lot, of why a Christian health insurance company and not a health share, is a reminder that, like, insurance itself is actually like a good for society. And people, there's one aspect, obviously, of protecting your family for your medical bills and having freedom to not have the burden of medical bankruptcy if something terrible happens. But in a unique sense, health insurance, and this is things that people don't often think about, health insurance provides the framework that actually pushes innovation. And I always like to use the example of the premature baby that's born at like week 20. There's an example, where we've had the longest, I think it was like week 21 was born, is the world record. And that baby has to stay in a NICU for almost a year, and it can cost over $1 million. And they have to have the most advanced technology to treat this 21-week-old baby as a beloved child of God that's worthy of being saved. And so the reason why we want to make a health insurance product is that health insurance provides the type of reliance that the providers and hospitals and the healthcare community can rely on, a stream of funding that they know is going to be there, where they're going to innovate for things like, how do we save a child at that young age? And that's something unique to the insurance model that I think really inspired us to create something that's both Christian, but also a great insurance product.
Right. And so, Bob, I'd love for you to, I think you're the best at telling the story and the impetus for the legal framework for Presidio, right? So a lot of people probably, like I did when I first met you guys, was, why hasn't anyone else done this? I was familiar, and so same with Alex, like, we're very familiar with the healthcare sharing background. My time at Remodel Health, like, we help bring, healthcare sharing to the employer market, but and to a lot of Christian employers, right? Christian universities, churches, so have it. But you guys bring this up, and I'm like, well, there's a bunch of Catholic healthcare systems, a lot of healthcare systems have health insurance divisions. Like, why hasn't this been done before? Why will Presidio be the first? Like, it doesn't make sense. So if no one else has done it, people with a lot more money and a lot more, interest in this space, why is it something we can just go do? So tell us a little bit about that, Bob, from a legal perspective.
I think there's two parts to the question. One is like, why does this have to be done, right? And
Sure.
that sort of builds on what Daniel just talked about, which is, why, yes, we need to reclaim healthcare for Christ, but why do we need to do that in the first place? Why isn't that already part of what healthcare is? And then the second part is why hasn't somebody already done this? And I think the answers are kind of intertwined. So, and there is an important historical and legal backdrop to what we're doing that kind of tees this moment up perfectly for the launch of the nation's first pro-life health insurance company. And that's largely defined by the Affordable Care Act, which is also known as Obamacare. It's the same thing. Obamacare is largely defining the healthcare industry in the United States today. And if you look at what that is, there were two super contentious and highly litigated prongs of the Affordable Care Act. One was the individual mandate, which required everybody in America to have insurance. And two is what's called the contraceptive mandate, which requires every plan offered to offer the full range of preventive services, including the full range of contraceptive services offered by HHS. So a lot of the listeners here might remember the Hobby Lobby case, which is when the Green family, a very Christian family, along with a few others, including Conestoga Woods, sued the administration and said, we're Christian. We don't want to be paying for other people's contraceptive services. And if you take a step back and look at what the contraceptive mandate means in reality, if your plan is guaranteed payment, is required to pay for contraceptive services, how does the plan actually pay for it? Well, it's through the members' premium dollars. So the plan is collecting premium dollars from its members. A lot of them are Christian, and a lot of those members are going to be fundamentally opposed to the use of contraceptive services. And they're using those people's dollars to come into a pool and then pay out benefits, including other members' contraceptive services. So you can understand why, regardless of where you are on pro-life or pro-choice issues, it seems un-American and anti-religion to require people to pay for and participate in services that fundamentally violate their religious beliefs. So the Green family, Hobby Lobby, they sued the administrator, that was the Obama administration, and they won a big Supreme Court victory, which was huge for Christians in particular and religious liberties more generally, that accepted faith-based employers from having to offer coverage that complied with the contraceptive mandate. So that was a big win, but unfortunately it remained largely unavailable to the vast majority of Americans. A lot of Americans are purchasing their insurance privately. They don't have employer-sponsored coverage. And a lot of them they might even work for Christian companies that don't have the scale and clout that the Hobby Lobbies of the world have, to go to the Blue Shields of America and say, hey, please write a special plan for my small group of 30 employees, right? Good luck getting Blue Shield, United, Aetna to draft a special plan like that. So it really primed Americans, I think, and set us up to offer the nation's first pro-life health insurance company, because there's currently nothing available. There are a couple of other key steps that have set the stage too. Number one is that Hobby Lobby case continued to be litigated, continued to be a hot button issue because it wasn't largely available to the vast majority of Americans. So it kept going back up at the Supreme Court. And I think it was in 2016, the two parties were arguing in front of the Supreme Court, and the Supreme Court justices literally said, can't you guys figure this out? Like, this seems like a big deal on both sides. Can't you figure something out? And they said, yes, we can. Well, several months went by and they didn't figure anything out. Donald Trump came into office, and in 2016, he issued an executive order. He kind of took a look at the Supreme Court precedents, and he said, let's figure this out. And he ordered, he issued an executive order that resulted in a rule that extended the Hobby Lobby victory to not only religious employers, but religious insurers as well. That was in 2016. To date, we're recording this podcast in 2025. Nobody's taken advantage of that. We actually talked to the woman who wrote the rule. She said, this is exactly why we wrote the rule. nobody's taken advantage of this yet. Now, this goes to your second question, Cameron, which is why has nobody taken advantage of it? And I mean, look around at the healthcare landscape. We live in a healthcare environment that promotes things like abortion as healthcare, right? It's sort of taken as a given among industry experts. And there are a lot of great folks in the industry. There are a lot of great Christians in the industry, but unfortunately, they're not the outspoken majority. And you can see why in a environment, in an industry that pressures everybody to think one way, it's really counterintuitive or against the grain to promote things that actually build the culture of life that are aligned with Christian values. And you could see why a lot of the big insurance companies, they don't want to touch Christian stuff with a 10-foot pole, because they'll be labeled as whatever, bigots, right? So you can imagine that I think that's a lot of the reason why we haven't seen somebody do this to date. You need somebody that comes in with strong values and is convicted of these issues to say, we're going to build a plan specifically for this because we believe this is the way healthcare is supposed to be delivered. Mm-hmm. And this is best for the patient and it's best for the providers too, because you have a lot of providers in this industry that want to practice in a way that aligns with their Christian faith, but they're pressured from these insurance companies to provide services that don't align with their Christian faith and values.
It's also hard, Bob.
It's also hard. So we do have a unique team of experts that has come together to say, we got the healthcare lawyer, we got the healthcare actuary, we've got a guy that's actually managed costs for huge blocks. We've got a guy that's actually been in the weeds building a company before and selling insurance products. So yeah, that's a small piece of it too.
Yeah, if you don't have the Bill Butcher, I think you're in trouble trying to start an insurance company. So that was our biggest hurdle to get over, is how do we get the Bill Butcher on board? We're going to have these bills. They need to be butchered, so maybe that's a good segue, Cameron, introduce the real answer, Bob, is they didn't have Alex Hart. I think that's the actual answer.
That would have been my answer. Would have been much shorter and succinct if I just said.
I think I would go with really hard. I think Cameron and I have had a chance to walk with you guys over the last, year and a half, and there's nothing easy about it. And we talk about often how the enemy is not going to sit and allow good things and allow godly things just to be ushered into this earth, right? And I think every wall and everything that's worth it is really difficult. And I think as you guys had said, this is worth it on multiple. Mm-hmm. I think we go through the protection of life and the biblical components. Every piece of that is worth it, right? And it's going to be really, really hard, which we've had a chance to see and walk through that with you guys. And I think, Bobby, I think that's a great segue to, we look at this healthcare system, right, that is broken. And we often talk, guys, about there's no shortage of podcasts or people out there that'll tell us how broken the healthcare system is, right? This doesn't work, or this doesn't work, or we can't do this, we can't do that, or people don't benefit from it. And yet it's a really, really wealthy system, right? I mean, they're CEOs of hospitals, $10+ million bonuses, these massive insurance companies. It's a broken system that has only gotten wealthier over the years, right? And it's a system that really has pretty much been unchanged for 50+ years. I think you had the Affordable Care Act in, and I think it was 2008 or I forget exactly what year, but the Affordable Care Act comes on board, and that's a big change that mandates coverage for everyone. But I think at the end of the day, what I just love and what I'm so grateful to be a part of this team is, how are we taking tangible things and make them applicable to our membership, right? How are we truly benefiting the everyday families that are going to be Presidio members? And I think when healthcare has only become more expensive with less coverage, I think, Daniel, to have a program and a policy set up, with no copays, we see a product that has, the typical insurance product is a ton of copays, extremely high deductibles. In order to control costs, we really have created a society of uninsured people. I think, most families can't afford a $2,000 to $3,000 event in their life, 3-4 kids.
one amazing thing about life. I mean, every guy on this podcast, I mean, you're talking about big families, right? And so you're talking about guys that have to look at their wives on a daily basis and make financial decisions that impact, how you live your life and whether you can go on vacation, do those things. And when you have an entire society of people that can't afford a $2,000 to $3,000 event, and we look at $10,000+ deductibles, you're uninsured, right? And so I think, when I look back, and I will always kind of, one of the things that drew me, other than just the obviously the faith component of this, is at Presidio, we want to empower our people and equip them with the tools to give them an affordable health insurance option that actually serves them, right? And I think that in the name of profits, in the name of, growing the bottom line as these CFOs, I mean, it's pretty funny. We don't have a CFO on this call, right? We've got an attorney, an actuary, a sales and marketing guy, and a cost containment guy.
We wear multiple hats.
Yeah, exactly. One of us is the VP of T, and you'll have to learn that as you go through the I'll go through the process with us. But I'll give you a hint. It's not the Bill Butcher. But yeah, I think we want to take Presidio to the people, and we want to empower our people to not have to budge on their faith values and the biblical pieces that none of us are going to budge on, right? But at the same token, we want to deliver a product that our members can use and they see benefit. And on my side of it, my little square, is going to be putting money back in our members' pockets so they can go use that for their family and for the kingdom.
It's funny. I think Daniel, you mentioned what an amazing mechanism health insurance is. And Alex, you mentioned how we want to build and add value to people's lives. And I think a lot of people's experience probably doesn't resonate with those two sentiments. It's probably like, I have health insurance. It's garbage. I'm frustrated with it. I don't get value out of it. So in a sense, and this goes back to the question that I was answering, Cameron, which is like, why has nobody done this? It's like everything is sort of teed up really well for this moment where, I mean, in a sense, the bar is so low in terms of people's expectations of what they can get and what value they get from their health insurance company. And we have a tremendous opportunity here to deliver a lot of value and to really exceed people's expectations with something as simple as like talking to somebody who understands what COBRA is when you call in with a question about your COBRA benefit. Like that's like it should be table stakes, but guess what? It doesn't always happen when you have a question about your health insurance.
That's a real story too of a major health insurer that one of us has calling into their call center. What's COBRA?
After what, 2 hours on getting
that's right.
Yeah.
Yeah. And I think that's the value. Like, this is kind of why we wanted to do this podcast for folks. Like, I think there's this, people are kind of, there's this like mystical, like mystery about like, what is health insurance? They're just controlling our healthcare. They're just profiting. And we wanted to like put the veil back a little bit and say, welcome you guys into the journey. Welcome, Christians that want something that actually, aligns with their values and saves their family money, but also know who's behind it. So we wanted to, have that transparency where at the end of the day, a company, an organization, whatever you're forming, it's about the people that are at that organization. And that was, when Bob and I started, the first thing that we knew we had to do is, how do you get the best in the industry, not just from skill wise, but who are actually going to care about the mission, care about the people involved. And that's why we have Alex and Cameron here. And we're going to continue to grow that type of team that cares about both mission and the actual quality of the product. But that's really insurance is just statistics. It's just math. It's just about, having the right amount of premiums collected and reserves to make sure that bills are paid on time. It's just making sure that you do those things the right way. And, to the degree that people have abused it is because of the people that are involved. And to the degree that we can do good, it's going to be because of the people involved in Presidio and how we can use this company to actually promote the culture of life.
Yeah. And I love that, Daniel, with the transparency is, we're sitting here how many decades into health insurance, and it's so confusing. it's so murky. It's so this fog over it, right? And the reality is that's intentional. And we are going to remove a lot of that from people so that you can truly see a transparent product and actually see how it works for you. I love making it transparent. Like we're actually going to do it.
Yeah. It's truly having, been in this space on the leading edge of a health insurance startup in the employee benefit space. I'm truly very excited about what we can do here and the opportunity we have to just, truly be different. We get to be different in the fact that we're going to be the nation's, first Christian pro-life health insurance company, which is pretty amazing to say. But the fact that none of anyone's premiums, and Bob, you started to hit on this, but no one's premiums are going to contribute to abortions and services you probably are not value aligned with. It's a pretty bifurcated issue, right? 50% of Americans are pro-life, 50% are pro-choice, regardless of their religious affiliation. And to know that your premiums are not contributing to those services, where with most insurance plans, your premiums are contributing to those services. There are exceptions, and there are the Hobby Lobbies of the world, where plans are not paying for that. But I think that's a big win for
There's
value
literally
aligned.
a federal mandate that says
right.
Insurance companies have to pay for it. So the exceptions are very small.
There's very few exceptions, but it's a huge win for those that are value aligned. In addition to that, we're going to touch on this more in future episodes, but the differences from healthcare sharing. So when you tell somebody we're building a Christian health insurance company, they're like, oh, is that like MediShare? Is that like Christian Healthcare Ministries or Samaritan? We love those guys. They've built, great organizations helping people. But talking about the differences between a truly Christian health insurance company, which Daniel alluded to a little bit earlier, and also how healthcare sharing ministry works, and some of the risk you're still exposed to on the back end because it's not insurance. And then also, one thing that's beautiful about what we're doing is that it's not an exclusive relationship with our members, right? Like you don't have to be a Christian to be on Presidio. You just have to know that your services that aren't aligned with our values are not going to be covered on the plan. But you don't have to be a Christian, which gives us an opportunity to minister as a Christian company to our members as well. Things that, I would have never thought of a health insurance company to do, like sending you a box of diapers when your baby's born. We have these crazy ideas every day where we're like, what if when a baby's born on our plan, we send them a couple months worth of diapers? And we're like, Bob,
what
can we do
stuff
that
so people don't hate us as an
Bob's
insurance
like,
company?
yeah,
what if people liked us?
Yeah, we can do that. What if we had no deductibles? So you're paying a premium every month, and when you go to use your plan, you get value out of it right away. So these are all really unique things that we're doing that I think set us apart. And I would say the big thing that we're really excited about is prolifeproviders.com, a website or a web app that we are building that's going to allow consumers to go out and rate and review physicians, nurse practitioners, any provider that kind of touches the soul of the person in their healthcare journey, and be able to rate and review them based on their value alignment. More to come on that, but that's just one thing we're really, really excited about. And I don't know, Daniel, I know, we're all very passionate about it, but Daniel, you probably got something to add there, but that's just an example of some of the things that we're doing that are very alternative to the traditional health insurance approach that, we're just excited about here.
Yeah, it really speaks to ultimately the mission side of what we're trying to do. And again, we're a health insurance company. You're here to save money and get access to care and make sure that on the big stuff, your medical bills are paid for. That's the first primary thing that we're serving people with. But then this second piece is how do we creatively really make people aware of alternatives in the healthcare space that actually align with God's creative order, as opposed to what has become kind of the culture of death in healthcare. And so we think of it in terms of, really there's in our small participatory way in this healing ministry, there's kind of three things that we want to do. Like the first is we want to make people aware of these things. And I think there's a growing trend of people exploring, for instance, natural family planning. We don't want to medicate ourselves. We want to actually use God's creative order to think about the spacing of our children and to be open to life. And people are interested for that for healthcare reasons, but there's actually a beautiful theological aspect to that of really being generous with our lives, being generous with how many children we accept. And natural family planning is something that's growing in interest, and we want to make people more aware of that. The second is equipping people. So, okay, you're aware of it. How do I actually, do some of these things that are non-traditional? We have great partners like My Catholic Doctor that has, like, for instance, natural family planning counselors. And we have, like people who struggle with fertility instead of going to the, expensive and kind of the IVF route. There's more natural NAPRO technology fertility treatments that truly, respect your body, who you are, how God created you. And these things take professional guidance to get access to. So make yourself aware. We provide the guidance and the counselors. And then that's where this provider tool comes into play, where you also want access to, doctors in your area that will know about these alternatives or will respect your values when you bring your children, your teenagers to. And oftentimes you can't see, like on their website, anything about their values, their faith, or anything. But anybody who goes to the doctor, and you can probably think of yourself and all of your interactions with physicians, everybody has like a story, a healthcare story, but no place to share that story. And that's what we're building with this tool is you can share your story with other people in the Christian community so that you're really participating with each other and helping each other in solidarity with each other to find the right physicians that are ultimately going to take care of your family in the right way. And so that's where an insurance company can actually play a role, which is be that guiding connector. And then the final piece is how do you make it, how do you increase access? How do you make it low cost, right? So these NFP got guidance counselors. Can we make it $10 to go see them? How do we make when we find these physicians who are practicing aligned with their faith, how do we go out and contract with them so that we make it really, really low cost for you to see those providers, right? And so that's kind of the kind of train of how we actually do this mission, awareness, equipping people, and then giving people great access, and especially on the low cost side. So we're excited to launch this tool. It should be coming out with the insurance product. And we're going to need people's help. We're going to need your help to start to populate it with all of your stories. And, that's going to be, we're going to have probably future episodes specifically talking about that. So that gets us most excited, I think, when we think about what we can do to help people.
Guys, I can't believe you guys just dropped that one. That's a big announcement.
Oh, that wasn't the full announcement. That's just a preview.
Did you get confetti from Zoom or whatever?
I didn't get any confetti on my screen.
Yeah, we'll do a more formal announcement for with your face on it, Bob. And I think the logo for the website is going to be your face, Bob. Just because you've done so much M&A work with physician groups, you're probably the right fit. But yeah, I mean that's an example. We'll likely have a episode or show that's just about accessing value aligned providers. We're looking at topics like health hacks for how to save money on health insurance, whether you're a member of a Presidio health insurance plan or not. Like, there are tons of tips and tricks out there for how to save money on health insurance, and there's already a lot of resources out there. But we come across these ideas and these solutions day in and day out, and we'd love to be able to share those with you.
Bill Butcher. The Bill Butcher has what did you say? 15,000 claims you've navigated in 5 years, something like that.
Yeah, it's been over 15,000, and I would say those are large claims. Everything from knee replacements, spine surgery, breast cancer. I think it's 3 heart transplants. So if I've done 3 heart transplants, I've lost count of everything else. But yeah, I mean, Cameron, that's a great point. I mean, I think one of the exciting things about this team is whether you're a Presidio member or not, we want you to use the pro-life provider tool, right? We want you, when you have a $10,000 deductible and you need an MRI on your shoulder and you don't have, $2,000 in your bank account, we want to equip you with the ability to go get an MRI for $150, right? I mean, it's different, and it's why I was I just believe in this mission in the deepest part of me is we want to serve people, right? And we're going to have a platform to serve people in multiple different, whether it's financially, whether it's, with our telehealth, whether it's, our mental health. I mean, there are just so many different tools that we're going to have. And we hope to build a community of people, like-minded individuals that seek out, and we don't want you to seek it. We want you to find it. Right. And hopefully we can be a gathering point for those ideas that help make your life better and help you be a better mom, a better dad, a better brother, a better sister. And I'm just excited about all of these things that we're going to be able to put together for everyone.
You talked about how opaque the insurance system is, the healthcare system is, and unfortunately that's the reality. And it does sort of take an expert to navigate that opacity. And the cool thing is, Alex, you are the expert, and like, we want to give you free rein to just it's like the butcher shop is open. Come talk to Alex and he'll show you how to carve up the bill.
Hey,
and get the price down.
It's the only product that we purchase that we don't know the cost of it, right? And so you have no idea how much it's going to cost. And if there's no other business in the world that's run this way, and you'd think it would be transparent. Yeah, well, and this will be, obviously we could go down this rabbit hole forever, but the insurance, the health insurance space is intentionally blurry to make people dependent upon insurance companies, right? And we just push that over to the insurance company and say, tell me how much I owe, right? Instead, our intention is to flip that on its head. And again, if you want to be a good steward of your healthcare dollars and you want to be a good steward of your health, we're going to give you the tools to do that.
Yeah. The analogy I like to use is that the reality is there are lots of solutions out there in different like microcosm, veins of the system, right? You have these cash pay surgery centers, you have these, like these discount type drug programs, you have some telehealth or telemental health, type solution. And so there are different solutions out there that at some point, depending on your needs, you may come across or you may hear about. And so, how can we leverage the entity that is health insurance, abstract a lot of the complexity? No one wants to talk to their health insurance company, right? Like, you don't want to be on the phone with them. Probably if you put that phone call off for a long time. And so how do we abstract some of that complexity, make it a very seamless experience, but then empower people to find access to these services? We're really excited about that. And we'll be, launching later this year. We're excited about, our future shows and future episodes. If you guys have if you have any questions, you can comment on the show. If you want to ask us anything, we can carve out time in future shows to answer those. But feel free to drop questions in the comments, share this around. We thank you guys for joining us and letting us tell you a little bit about our hearts and the why behind Presidio and what we're building. And hopefully, when we're in your state and in your market, you'll become a member. But if not, we ask that you would share this around and champion what we're doing if it's aligned with your values. So thank you for joining us.